Okay, your next question is, can taking testosterone affect fertility?
Oh my gosh, that's like throwing me a soft pitch. It's a disaster. So many men are going on testosterone now. It's the fad, it's the latest because it will make you stronger and it's easily available. You can put it on your skin, you can give yourself a shot at, and so many doctors, there's men's health clinics, and they give them testosterone. They hand it out like candy. And it does make you feel stronger and more alert. There's no question about it. Uh, Improves your sex drive. However, it inhibits your pituitary gland secretion of FSH and LH. So your testicles that would have been that size shrink up and get small, and you're not making sperm at all because you need those hormones for your testicle to make sperm. In the absence of those hormones, your testicle just, in a sense, dries up. And you wouldn't, I can't tell you how many patients come to us and for infertility, and they don't know this. The doctor who gave them their testosterone doesn't tell them about it. And when I tell them, oh my gosh, your testosterone is causing you to have no sperm, they're just surprised and shocked, and they love being on the testosterone. So we make them go off the testosterone, and usually the sperm count will return to normal in anywhere from 3 to 8 months. And then when it returns to normal, it may be they'll just get pregnant naturally, or you might have to do IVF involving injecting the sperm into the egg. But in most cases, men will recover from this. But what if the wife is 39 years old and you're in a hurry to do the IVF? Well, you're not going to be able to do it if he has no sperm. So you have to wait till he has sperm. You can, of course, freeze her eggs, but most couples would rather wait till there's sperm and get the embryos. So, yes, testosterone will definitely make you sterile.
Okay, and I guess the second part of that question too is